Integrated health and social care is about joining up care and support around what a person needs.
So the vision for integrated care for Islington is firstly to deliver person-centred care. So to ensure that everything we do as organisations is coordinated around what people really want and what they need. Our work is very much based on what people in Islington have told us. We have a lot of information that's been gathered over a number of years, and it is not dissimilar to the story that's being told nationally.
So I was the team manager of the N19 project. We ran, initially it was going to be just for 10 weeks, and then we ended up running for 9 months, from June 2013 to March 2014. And so we were a multidisciplinary team. We were co-located in one office. We had staff from social services, social workers, support advisors, and workers from health, so physiotherapy, occupational therapy. Later in the pilot, we were also joined by community nurses, community psychiatric nurse. We also had senior enablers from reablement in the team and rehabilitation assistants as well. At the moment in social care, if somebody goes into hospital, for example, the person is assessed in hospital by the social work team, then potentially seen by the reablement team, and then following that likely the ongoing support and review team where I work. With the new way of working, the service user was able to see, instead of all those different people, one professional right the way through.
The N19 pilot was a really good example of integrated working across health and social care. I think this was a very good example because actually staff worked much better together. They had very, very good relationships, very good leadership. And I think this then translated into the care that people received. People really felt that they were receiving a much more coordinated approach.
When the team began, it wasn't as if all members of the team were completely pro this new way of working. Lots of people in the team had real doubts about how it could work. And then I think moving forward and as the model developed, everybody then did buy into it. I think it's something that people are always going to have doubts and be fearful about a new way of working because it's a huge change and it's completely understandable. I just think that people just need to focus really on the service user and how much more beneficial that it is to them. And then that actually gives a lot more job satisfaction at these. That makes things, kind of makes all the hard work worth it in the end.
So integrated service provision is much better for people because they have a smaller team of people working around them. They know who those people are, they develop relationships, and there's really good evidence that continuity of care and knowing a patient's story really improves the quality of care that you receive.
One of the things that really sticks in my memory is one of the service users who used the N19 service and her daughter who wrote a letter just really celebrating the fact that it meant so much to her to have one person who coordinated her care and support from the time she was in hospital to going home and getting better and having her reablement and recovery. And that was one of our social workers called Shane, and the strapline from the N19 project became "Everybody needs a Shane." Next steps, we're building on what we've learned from the N19. We're working with our colleagues in the clinical commissioning group, our colleagues in Islington Health and the Mental Health Trust, and in the voluntary sector, and we're developing what we're calling a locality model. So using this principle of having somebody who coordinates somebody's care, working really closely with colleagues in general practice and across the whole sector, and rolling out the principles of what we've learned.